This man, Bill Bryan, decided to take a road trip from northern Alabama to the Florida Panhandle with his wife Beverly in order to check on a rental property that they owned in the area. Little did either of them know this miniature vacation would be the last trip they would ever make together as a couple. In this video, we'll lay out exactly how an impromptu trip to the hospital for some mild side pain led to what is being alleged as one of the worst cases of medical malpractice the American public has ever seen, including a heart-wrenching request Bill's wife Beverly made before the surgery. And our story gets even crazier. You see, Dr. Shaknovsky, who is the surgeon who performed the allegedly botched operation on Mr. Bryan, had previously already had at least one other lawsuit filed against him, seemingly due to a lack of entry-level understanding of the human anatomy. A lack of knowledge which could have ultimately been the cause in yet another catastrophic surgical error by Dr. Shaknovsky. And yet, despite this, the surgeon was ultimately allowed to continue practicing medicine. Marriages are tough. Most end in divorce, people oftentimes cutting and running at the first signs of trouble in a relationship. But for Bill and Beverly, that wasn't the case. Their 34 years of marriage stands as undisputable evidence to younger couples that a forever love does still exist. This sentiment of continued, unfaltering commitment to each other is perhaps the unspoken feelings that Bill and Beverly had when they were climbing aboard their vehicle and headed for their rental property near the sunny beaches of Destin, Florida. A trip that would ultimately change their lives for the worse forever. Problems arose when Bill suddenly felt a sharp pain on the left side of his body shortly after they arrived in Florida. Keen to err on the side of caution, Beverly rushed her husband to the Ascension Sacred Heart Emerald Coast Hospital, where they eventually met with Dr. Thomas Shaknovsky. After several days of conducting MRI and CT scans, it was discovered that a cyst had ruptured Bill's spleen. If you're not aware, the spleen is a small organ that's located inside the left rib cage just above the stomach. Our spleen's main function is to filter and control the level of red blood cells, known as platelets, and white blood cells into the bloodstream. So even though the spleen is classified as a non-vital organ, it plays a significant role in safeguarding the human body from infections. Realizing the danger of this situation, Dr. Shaknovsky immediately recommended surgery to remove the spleen. This suggestion, however, was met with strong resistance from the wife Beverly. Call it womanly intuition, but something was telling her that her husband would fare much better under their established doctor's care back home in northern Alabama, who had already spoken with Beverly and promised her that he would have surgeons standing by upon her husband's arrival. Dr. Shaknovsky rejected her request. He argued that it was better to conduct the operation in Florida because Bill might experience serious complications and bleed to death if he was moved. Dr. Shaknovsky is a licensed surgeon with over 15 years of experience and undoubtedly gave off a perception of experience and medical authority, which would ultimately contribute to Beverly relenting and giving the go-ahead to have the surgery performed in Florida. Impossible to know at that time, but she had just put her trust and the life of her husband in the hands of a medical professional who probably should not have been given the clearance to care for farm animals, much less for human beings. The questionable decision started even before Bill was first put on the operating table. Firstly, Dr. Shaknovsky scheduled the operation for 4 p.m., which drew immediate concerns from other hospital staff due to their skeletal crew. Also, some members of the crew reportedly felt that the doctor wasn't skilled enough to perform this procedure. But other than a few rumblings behind the scenes, nobody confronted him about these issues. And so, on the 21st of August of 2024, Bill was wheeled into the operating theater full of life and ready to undergo a procedure that should normally last between 1 to 2 hours. Unfortunately, he never made it out alive. Beverly was, of course, devastated. It was supposed to be a great summer, one filled with all the good things that couples share in the golden years of their life. However, on that nightmare of a day, there was nothing good to be shared, not even a goodbye. Beverly lost her husband just 2 days before their 34th anniversary. It's an indescribable level of pain, of course, But you can imagine the disgust and rage that Beverly felt when she realized that her husband's death was allegedly the result of a surgical error made by Dr. Shaknovsky, the very person that was supposed to save his life. It is a heartbreaking tale, but hold on to your seat because this is only the beginning of what's probably the most horrific alleged medical homicide stories you'll ever hear. So after the surgery, Beverly was reportedly told by Dr. Shaknovsky that Bill's faulty spleen had grown 4 times larger than usual. This supposed medical professional also claimed that the spleen had miraculously migrated to another part of the patient's body. However, investigations by Beverly's lawyer, Joe Zazar, revealed that, of course, these claims were false. According to court documents and accounts of eyewitnesses present during the operation, Dr. Shaknovsky made several errors during the surgery. For starters, he reportedly converted the laparoscopic procedure to an open one, citing poor visibility due to Bill's distended colon and blood in the abdomen. But he didn't document the colon as part of his reason to change the operation technique. The procedure became even further complicated when Shaknovsky dissected ligaments attached to an organ he believed to be the spleen. This ultimately led to an artery being severed that resulted in a fatal amount of blood loss that sent Bill into a cardiac arrest. At this point, the operating staff knew that something wasn't right. So they initiated the process for an emergency blood transfusion while also administering CPR to Bill. While all of this was going on, Shaknovsky continued to dissect the said organ without asking for any assistance whatsoever. And in the end, he removed the spleen, which actually turned out to be the liver. The operating staff immediately realized the difference, but Dr. Shaknovsky refused to admit his mistake. Instead, he directed a staff to label the liver as a spleen and send it to the pathologist. The staff who carried out this assignment knew the organ was not a spleen, but they chose to obey the instruction anyway. But Shaknovsky wasn't even done with his cover-up. He visited the operating room 3 times after Bill had been pronounced dead, and on each occasion, he emphasized that the patient had died due to a spleen complication. He made the same argument to Beverly, but she just refused to believe him. And thankfully, Beverly Bryan's legal team has been able to uncover the truth. Now she is demanding justice for what she describes as an unnecessary and brutal death of her husband. "My husband died while helpless on the operating room table by Dr. Shaknovsky," Beverly Bryan said. "I don't want anyone else to die due to his incompetence at a hospital that should have known or knew he had previously made drastic, life-altering surgical mistakes." Beverly's quest for justice is absolutely justified, and it could have wider implications beyond this case, because as investigations revealed, Bill wasn't the only victim of Dr. Shaknovsky's surgical errors. As recently as May of 2023, the experienced surgeon performed a surgery to remove an adrenal gland from a patient, but he ended up removing part of the pancreas. And just like he did in Bill's case, he ordered the pancreas to be labeled as an adrenal gland. An out-of-court settlement was reached. The botched surgery was basically swept under the rug after the settlement, and somehow the doctor was allowed to continue operating. However, following Mr. Bryan's death in August, the settlement of the once largely ignored wrong site surgery is back in the forefront. In fact, it's one of the biggest points that Beverly's attorney is planning to present before the court, showcasing a pattern of operational incompetence. But in the meantime, the Florida Department of Health has approved the emergency suspension of Dr. Shaknovsky. In a strongly worded statement, the state's Surgeon General Joseph Ladapo justified the suspension, saying Shaknovsky's repeated egregious surgical errors make him an immediate serious danger to the public. This, of course, is not a permanent fix. Let's all hope that Shaknovsky is thoroughly investigated and, if warranted, brought up on criminal charges that will help further prevent any future trusting patients from falling victim to gross incompetence and provide a little bit of further justice for the Bryan family. Thanks for watching this video to the end. If you found it insightful or entertaining, please hit the like button. Subscribe to the channel if you haven't already for more in-depth medical malpractice content just like this one.